Ohio is the latest state to ban gender-affirming care for transgender youth and to limit trans athletes' participation in school sports. A total of 23 states have passed trans health care bans, with 20 approved just in the past year. Stephanie Tsai has more.
Amna, Ohio Governor Mike DeWine had blocked this bill late last month, saying parents and doctors should make decisions around gender-affirming care, not the state. But yesterday, the Ohio Senate overrode the governor's veto. The new law bans gender-affirming surgeries, new prescriptions for puberty blockers and hormone therapy, and restricts mental health care for trans minors without a parent's or guardian's consent. Doctors who provide care in violation of the law can lose their medical license. It also bans trans women and girls from playing on women's sports teams in high schools and colleges. Orion Rumler covers all this for the 19th News and joins us now. Orion, what kind of impact will this law have on transgender youth and transgender athletes?
Thank you so much, Stephanie. So this law, which important to remember, will not go into effect until late April, like you said, would prevent trans youth from accessing medications such as puberty blockers and hormone therapy as part of their gender-affirming care. And there are also other restrictions at play in Ohio right now that Governor DeWine put into place. Whenever he vetoed this ban, he made a couple administrative proposals, and those restrictions that DeWine brought would affect adults as well as minors.
We spoke to someone from Trans Ohio earlier. Here's what they said about the effect the law is already having on Ohio families.
We're in the process of essentially starting refugee enclaves in half a dozen states of people who used to want to be in Ohio. I mean, many of them still do. You know, these are people who've lived here their whole lives. They have extended family connections, businesses, jobs, everything that you would expect for people who live somewhere. And they're in the process of deciding to uproot themselves or what they do.
So, Orion, they're saying people may just leave Ohio, but with nearly 24 states enacting similar bans on gender-affirming care for minors, where do these families with transgender kids go?
That's the question is, as more states, like you said, ban this care, there aren't many options for them to go because if you look at a map of which of the 22, now 23 states have put in place a gender-affirming care ban, it's basically the entire South. And then in Ohio, we're seeing more into the Midwest. So families, not many families have the ability to just pick up and leave. And the ones I've spoken to in other states, when they are able to move and decide to do so, it's usually like quite a distance, like cross country, like just as far as they can get.
I want to play what a Republican senator who supported the Ohio bill said.
We're not outlawing all trans in the state of Ohio. We're just asking you to say, wait till you're 18. Wait till you have the ability to make the decision with your unmature mind to give that a break.
So the backers of the ban say they're trying to keep children safe from medical experimentation. That's what they call it, citing risks, for example, with puberty blockers. Orion, where does the evidence stand right now? What is best for these children mentally and physically?
So whenever a child is going through with gender-affirming care, it already involves elements such as a mental health screening. It already involves being told of what the consequences are with the child and the parents involved in going through a process of these are all the irreversible changes, these are the reversible changes, here's what you can expect on the line. So all of that is already part of the process. And gender-affirming care has been approved by several major medical organizations who say this care is safe. And it's the way that Republicans frame this care, it's framed in a way that they're just given this care without any context of what they can expect and what the side effects are. And that's just not true. That's always a part of the discussion when you're receiving this kind of care.
You've covered other ways states are targeting trans people in new proposed laws. What are you watching for in the year ahead?
In the year ahead, I'm watching for more states to be focused on restrictions on trans adults. beyond gender affirming care. Right now, at least 10 states are trying to change how they define sex in their state law based on reproductive ability in ways that would prevent trans people from being able to access identity documents, which is their driver's license, from being able to access public restrooms, even in Florida from holding office. And these definitions, based on reproductive capacity, would also exclude cisgender women who have certain health conditions. And advocates are really concerned about these bills. So that's one thing I'm watching in the new year.
Orion Rumler with the 19th News. Thank you.
Thank you so much, Stephanie.